So when we look and compare Ontario to many European countries and even to Canada as a whole, you will find, and certainly this is in the government's own numbers, that in fact Ontario's debt is not, we believe, at the crisis level that is being purported. The story is for the public and certainly for us as nurses that we ramp up the crisis, we scare us all into submission, and then we do the cuts. The cuts that we find are not going to be the fix for the system. Let's look at it. 1998 to 2003 in Ontario, for example, the government lost over $62 billion. $62 billion in tax revenues. The upcoming proposed cuts to the corporate tax rates for the next fiscal year in Ontario, taking it from 11.5 to 10, is going to reduce our revenues by an additional $2.5 billion. It's lost revenue. It could be used to reinvest in our public services. It could be reinvested to improve the access to health care for all Ontarians. The corporate tax cuts that we have already seen happen in Ontario, as you're probably well aware, have not led to job creation. And the employment growth, if we look at the third quarter of 2011, was zero. To set the context for the magnitude of the cuts expected in healthcare in Drummond's recommendations, it's informative to review the auditor's report that was released just before the fall Ontario election. The auditor's report expected healthcare funding to increase by around 3%, but Drummond has even lowered that expectation to 2.5%. Even at the level of 3%, the auditor said that hospitals will have to find $1 billion in savings. It will also require significant reductions in long-term care and in home care. At the same time, Ontario has, unfortunately, the dubious honor of having the second lowest ratio of RNs to population in the country. We have faced job intensification since the 90s when thousands of our positions were cut. It's resulted in RNs working ever-increasing hours of overtime, which of course has led to increasing illness and injury. And if you are not aware, nurses are the most ill and injured profession in Ontario. We face the risk of cost-cutting measures that will be adopted that we believe are going to choke off any economic recovery and will lead to long-term damage in Ontario. We've done our part in supporting balancing the budget, and now I think it's time for, in fact, other people to do that as well. Establishing tax rates for corporations and the wealthy, spurring job creation for both the public and private sector, maintaining public not-for-profit services, and strengthening the retention and recruitment of healthcare workers. We can and we will emerge from this current crisis, as they call it, with a strong economy, a strong public service, and a healthy workforce. And most importantly for us as nurses, healthy Ontarians. Thank you.
Thank you very, very much.